Let's hit it.
Hi everyone, and welcome to Alzheimer Speaks Radio. I'm your host, Lori La Bey, and I'm so excited that you're joining us today. We are going to have a fascinating conversation as usual as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
All right, here we go. What you think about, you will bring about the mental change. We will.
Hi everyone, and welcome to Alzheimer Speaks. I'm Lori La Bey, the founder, and I hope you enjoyed our opening music called Clarion Call by the Mark Arneson Band, featuring Maya Dore. You can download that on any of your favorite music platforms if you'd like. For those of you that are new to the show, we're about sound information, not just sound bites. We like to have true conversations with real people in the trenches, and maybe, just maybe, you can be our next guest. Reach out to me anytime, and I'd love to have a conversation. I want to thank all of our listeners. Your likes, your clicks, your shares have really expanded our reach and helped us with collaborations and build a sense of community and raise awareness about all of the services, products, and tools that are available. Now, during this time of COVID, Choral Health is letting people download their free music app, Music First and Choral Faith. So you can just go to Choral, C-O-R-O, health.com for more information. I also want to draw attention to a survey that's out on caregiver burnout, and it's put together by a student, Chantel Horn, over in New Zealand, and you can find out more information regarding that on our website or our blog. Just go to alzheimerspeaks.com. Now, I don't know if all of you know that it is World Alzheimer's Month, but actually on Monday, it was World Alzheimer's Day. And so Dementia Action International is putting on a Meeting of the Minds webinar about human rights and a practice model for residential aged care. And you can find out more on that by just going to ai.org for that. I also want to give a shout out to Artist Senior Living. We did our first Artist Way Memory Cafe this last week, and it went marvelous, and we would love you to join us on the third Wednesday of each month from 1 to 2 o'clock. Again, you can find more information on that by contacting them directly at 612-200-0506. One last shout out I just want to give to the Foot Bar Walker. It is an amazing tool for people to use. It's not just a walker. It helps the patient build upper body strength. It reduces falls, and it really takes a lot of stress and strain off the care partner as well in terms of getting them up to the walker and back down. So check out the footbarwalker.com. Let's get to our guest today. I'm really intrigued to talk with this person. Her name is Dr. Andrea Klemes, and she is the Chief Medical Officer for MDVIP. She is also the Executive Organizational Leader of the MDVIP's Medical Advisory Board that supports the quality and innovation in delivery of their healthcare model, drawing expertise from all their affiliate physicians. And today we're going to be talking about a brain health survey that they have, along with a lot of other things. So I know you're going to enjoy this interview. Welcome, Dr. Klemes. How are you doing today?
I'm doing well. Thank you for having me.
Well, I'm excited to have this conversation. You know, it's World Alzheimer's Month, and it's actually World Alzheimer's Day. this week. And so there's just so much stuff going on. I know you guys are really getting involved with Alzheimer's and dementia. And you have a survey that shows that most Americans don't know the facts about brain health, which I would totally agree with. And yet they're constantly worrying about, do I have dementia? Is this Alzheimer's? Do I tell anybody? Do I go to the doctor? Why is there such a disconnect about their concern and what people actually know?
Well, the MDVIP survey found that 2 in 3 Americans are concerned about their brain health, but more than half or almost half failed our brain health IQ quiz. So there's a disconnect. I think the disconnect is education. You really need to know about you. You need to find a doctor, like an MDVIP doctor, who can partner with you to help you understand what diseases put you at risk, what risk factors put you at risk, and what you can do to mitigate some of those risks.
Oh, I totally agree. My mom had dementia for 30 years, and I used to sell residential real estate, and I worked a lot with senior housing in terms of helping people transition. And I was so frustrated of the lack of information. And that's actually what got me into this space, was there's gotta be a better way to help families and to get resources out to them. Now, the majority of Americans say that they're comfortable talking with their doctor about brain health, but I got to be honest, I don't think they are. In the conversations, and I talk with people all over the world, and they always complain that the doctors don't give them resources and they're not helpful, but yet I don't think they're necessarily asking the right questions. So what should they be discussing with their doctors?
Mm-hmm. It's not even just them asking the right questions, but it's the doctor having the time to really work with them. So one of the most important things would be to get a cognitive test. Our MDVIP survey showed that a staggering 65% of people over the age of 55 have never had a cognitive test, nor have they had, over half haven't had depression screening or a hearing check or even a neurological exam, all things that can pinpoint risk factors for cognitive decline. So you need to kind of be prepared, just like with any other disease. You need to be prepared when you go into your physician and make sure that they have the time, they have the knowledge about the screening tests, and then they can really work with you. At MDVIP, the doctors have tools to help you with things like diet and exercise and those screening tests that you need to do to look for cognitive decline or hearing loss, all things that can affect your brain health.
I really like that you mentioned up the time and the knowledge, because I hear that repeatedly from people. I'm in and out. I feel like I'm on this stopwatch, and then they throw me to the nurse, and I still don't feel like I'm getting all my answers. I'm overwhelmed. I'm emotional. Sometimes I don't feel like they're very compassionate in terms of their delivery, and yet they all understand they're under this kind of insurance pressure to meet the time frames and see so many clients. And then the knowledge base is really huge, because so many people tell me it takes them 2 to 3 years to get a diagnosis. And I know that it's complicated and it can mask itself like depression and so many other things. Are you seeing that with your clinicians as well, or do you really feel like you've taken that extra step so that they do have the knowledge and they do have the ability to take the time with their clients?
Yeah, I feel like the MDVIP network has that extra step. Most physicians, we've all gone through medical school. I went through medical school and a fellowship and an internship and a residency. And so I think we learn a lot. But unless you have the time to sit with somebody and really try and get to the root of things, I can give you a perfect story. I had one of the sweetest patients. And I mean, the type of woman who at 85 is, 4'10", and you feel like a wind will blow her over. And she was very lovely, had diabetes, would come in every 3 months, and we were working on taking care of her blood sugars. And I just couldn't understand why we couldn't get them under control. And her daughter-in-law was a nurse and a nursing supervisor at my hospital. And we'd run into each other in the hallway and we'd question things. Finally, the daughter went over to the house, drew up her insulin, put it in 2 little boxes and put them in the fridge and said, take this in the morning before breakfast, this in the evening before dinner. And we figured that would fix it. Still didn't help. And so the daughter and I finally sat down with the woman one day, and she was so charming. And she would giggle and smile at us. And we finally realized that, also with some cognitive testing, that she had cognitive decline and she actually had Alzheimer's, we later went on to diagnose. And she was so good at masking it and so good at giggling to us. It's one of those things that always sticks with me to say, you really have to have that time. And that took a lot of time between working with the daughter-in-law, working with her. And you need to have that. You can't have, to your point, a physician in traditional practice who has, we always used to call them the doorknob questions, because their hand is on the doorknob and they're about ready to leave and you're asking that last important question. And so you need that time, and you need to be doing the screening. When you ask most people, when was the last time they had a hearing test? Unless you're complaining of an issue, it's probably been a long time. And many of us don't really know if we're starting to have hearing issues, although my daughter keeps telling me I have one.
Well, that's interesting, and I love the doorknob question too, because that is so true. I do it all the time, to people when I'm having a meeting, and then it's like, well, what about, because you just have that few extra seconds to process something, and that is really, really important to be able to do. I also think when you were talking about the masking of symptoms, people are masters at that. Nobody wants to feel less than. And all of our lives, we have had to adapt. And so we adapt when symptoms appear. And yet, once there's a diagnosis, there seems to be this cutoff line too, that where people don't want to adapt anymore. They just want to go into denial. And, it's working the family and the patient all through that. At one time. How do people recognize some of the early signs of dementia or Alzheimer's disease versus normal aging? I just had a friend call me up the other day and go, Lori, I think I'm losing it. We kind of talked through things, but I'd like to hear your opinion and what's your spiel when you talk to patients?
Sure. So I think the red flags are just like my patient, memory loss that really disrupts your daily life. Poor judgment, poor decision making. I mean, it's not when you walk into a room and can't remember why you went there and go out and remember in an hour or even in 20 minutes. That's the normal consequence of aging. I think that's part of, the bigger educational issue with Alzheimer's also, as many people think Alzheimer's is just normal. If you get old enough, you'll get Alzheimer's. So why would you bother to think about it, get screened for it, or do anything? And there are so many things you can do to mitigate those risk factors and look for them ahead of time so you can keep your brain sharp.
Yeah. I think there's just so much fear because of the lack of education and awareness. Yet, since the 10 years I've been in this space, it has gone up significantly, but it's still a smidgen compared to where we need to be. And so, I can talk when my mom had dementia, how their friends kind of scattered. And then after my mom passed away, one of their friends, the husband, got diagnosed. And it really still wasn't greatly talked about. And now he's passed away. Now the wife has it. And it's still a subject that the family is having a hard time broaching with the mother because there's such great fear. So just because you're familiar with the path or you've walked the path doesn't make it any easier. And those family dynamics they vary so much in every family. Hopefully there's at least one person that gets it and can help support you through that. One question I want to talk about too is, do you recommend when a patient comes to you that they have a second set of ears in that appointment if they're comfortable with that?
I think that's good for anything. I know my dad had pancreatic cancer, and if you sit in a doctor's office and somebody uses the word cancer or Alzheimer's, any of those, viscerally, emotionally invoking diagnoses, somebody else needs to be there to listen, to actually hear what they say. Because I know that my mom will tell the story that when they were sitting in the doctor's office, and when they said, you know, yes, you have pancreatic cancer, which of course, when I reviewed one of his scans, I knew early on, you know, I knew before they sat in the doctor's office. But, you know, your brain kind of shuts down. You don't want to hear, or you start going down those paths of what does this mean? You know, whether it's the person who, what does this mean for my family, or what does this mean for me, or what does this mean for my spouse? So getting others involved so they can help you remember and help you just and support you. You know, our MDVIP survey showed that 1 in 3 in the survey had a family member with dementia. So you would have thought that they would have passed the quiz, right? Because at least that many people should have gotten it right, but you know, nearly half failed. So it's education and it's pulling in the families. I think, to your point, what you've been doing for the last years is just amazing, to get those resources that support together. And you know, you're not in it alone, and it can't be easy to walk into a room and talk to your mother and her not recognize you, right? I mean, how did that, you internalize that, and it can be an easy thing to do.
Yeah. One of the things I wanted to mention, and this is a perfect opening for that, I wanted to ask you is, you know, what is some of the good news? You know, what are some of the steps of reducing the risk of cognitive decline? And then, you know, also with you saying, you know, how difficult it is when someone doesn't know you anymore. I personally found great gifts in going there and in accepting that. But again, it's getting people in the right mind frame to even open the door to some of these things. But what are some steps that people can take to really reduce that risk?
I mean, I think there is a silver lining, and our MDVIP study showed that 80% of people said that they want to learn and they want to mitigate their risk. But it's interesting because only 1 in 4 knew what diseases impacts their brain health, things like diabetes, or what other risk factors, things like gum disease, or even just how to mitigate any of those risks. So again, and you know, you said this before too, I think education is the key. And it needs to be personal education, because, you know, if you have, my mother-in-law has diabetes, right? My mother doesn't. So their risks will be very different. They're very different people with very different risk profiles. And you need a physician, like an MDVIP physician, who can work with you and know, well, maybe you don't have diabetes, but your mother does. And so we do need to worry about that in you. You need to get your sugars under control. Or, you know, have you been screened for depression? Have you been screened for, you know, hearing loss? All things that can affect your brain health also.
Yeah. Well, and then you get into, for my mom, for 10 years, she was told by her doctor it was her hormones. And my mom used to say, this ain't my girlfriend's hormones. And she was just like, I know it's more than that. I've talked with my friends. It's very different. But, you know, she had a doctor that they had gone to for 40 years. And, you know, that was 36 years ago. Very few people were even talking about this, let alone having any sense of knowledge. I think the other thing that is really important about delivery of that information to people is using multiple platforms so that we engage them in their learning style. Especially in this fast-paced world, which can be a gift and a curse, you know, all wrapped into one. And that's one of the things I've tried to do with Alzheimer's Speaks, is do videos like this, yet have the audio, have the blog, different ways that people can tap in if they want to engage. And I also think, and I haven't seen this done well, I guess, and maybe I've missed it out there, but even having a, I hate to say support group or chat group that focuses on reducing the risk, and people talk about what kind of exercise are they doing, what are they engaging in, how have they changed their food habits. We now have a lot of support groups through Facebook. I'm going to use them primarily because that's probably the biggest one, where you can put in, you know, dementia caregiver or living with, and you'll find all kinds of groups for all different types of dementias. But yet I haven't seen one that really has engaged people to talk about, let's really do this. you know, and I'm probably one of the worst offenders. I talk a lot about exercise and eating well, and I still don't do it to the level that I need to do it because I'm so busy trying to push out the word. That's my excuse. But, you know, you have to make time. I know that too. And I know that I'm just kind of in a denial state in some levels, and I need to change that because there is a risk factor, you know, for me. You know, that's just, there's a risk factor really for all of us because dementia doesn't know any boundaries. It doesn't really care.
Right. And you know, it's very hard to prioritize yourself.
Mm-hmm.
And, you know, we're very good at prioritizing everything else. Even, you know, being on time for an interview, right? I can prioritize that and be here on time for you. But to your point, did I do something for me, or did I go exercise this morning? Or did I make that healthy choice for lunch and have a salad versus, you know, the burger and fries?
Yeah.
So, you know, it is hard for anybody to do that. But I think the knowledge really helps. I have found over years, and not just in my private practice, but, you know, supporting 1,100 physicians across the country, you know, almost 350,000 patients, is that when you have that information, you know, if you know that I don't, but if I had diabetes and I had gum disease, and these are things that's going to put my brain health at risk and my heart health at risk, then I need to do things to make those better. And what do I need to do? And, you know, going to a dentist is an easy thing to prioritize as long as you're not too afraid. But, you know, and in this time during COVID, it's hard because do you feel comfortable going to the dentist? Do you even feel comfortable going to your doctor? Thank goodness for virtual and telehealth right now. But there's a lot of things that I think do go through people's minds. We just have to find the right way to educate them. And what I've found is that trusted physician who has the time to sit with you and go through it, and with your family member if they're there with you. That's the magic that happens in MDVIP offices every day.
And that is so important. I mean, I talk with people all the time, and they're like, we don't feel comfortable. It's like, then you need to go get another opinion. You need to seek another doctor. That is your right, and you're able to do that. And yet there's, I think, still ingrained, especially with our older adults, well, no, this is who I've been assigned, and my doctor knows best, and not to question it. And nowadays people are like, hey, I was online talking with Dr. Google, and they're bringing this and this and this, and that might drive, you know, doctors crazy. But in some ways, it's also can be educational for the physicians to find information that they may or may not have known, or be able to put a squelch to something that's like, no, please, this is not a good idea. And so I think those things are really important. What do you think are some of the most striking findings from the survey? You've touched on some of them, but are there some others?
There's actually, and it goes to this whole education, and the word I was thinking of when you were talking about that is being an advocate for yourself and you doing some research. I mean, as a physician, I never minded when somebody brought in, you know, what is this medication good for me, do you think? Because it starts a dialogue. It opens up that conversation to say, well, you know, this one's probably not right for you, but what about this one? So in the MDVIP study, we found that 1 in 3 did not know that there are diseases that can be mistaken for Alzheimer's, mistakenly diagnosed as that. So things like depression or thyroid issues, brain bleeding into the brain, HIV, or even a urinary tract infection, especially in an older patient, can present as, you're nodding your head, can present as cognitive decline and being diagnosed as Alzheimer's, when all of those things are treatable and some curable. So you really need to, especially if a family member brings in a parent, to know about these sort of things and say, hey, look, did you look for these? Hopefully the doctor would have the time and the tools and all to do that. But if they don't, then you need to be an advocate for yourself or your family member.
Yeah, I'd like to just mention a couple others that I have heard of that can kind of give those false positives pointing you in the wrong direction, is the dehydration, because a lot of people, as we get older, we don't like to drink as much because we got to run to the bathroom more, and so they want to limit that, and they don't want to have an accident. or medication mix. You know, you're getting one
Very
medication
much.
here and one medication there, and being able to talk with your doctor, or even the pharmacist will assess those things and then can talk in the doctor's language as to why it's not good and what alternatives are. And then vitamin deficiencies sometimes too. So there's a lot of things that have to be pushed out of the way first, you know, as you're going through with that. Now, another thing that I hear, and I love that you brought up gum disease, so I'm going to go there first, because I had someone on the show, I mean, years ago, about gum disease, and people just like, that is like quackaroo. There's no way. It's about plaques and dangles, and it's so interesting, all the different things that are coming up right now in terms of the disease. And can you talk a little bit about the gum disease itself?
Yeah, sure. So when you have, you know, periodontal gum disease, there's infection and inflammation in your mouth. Well, as you can imagine, if there's inflammation somewhere in your body, it can be anywhere in your body, especially if it's in your mouth, or if you have, you know, like an infection in your heart, or even like an appendicitis. And you know, you've heard of people where that gets into their bloodstream and goes throughout their whole body. If you have this chronic inflammation, it makes you more at risk for a heart attack or a stroke. But then also some of it, that inflammation, it can cross the blood-brain barrier, and some of those bacteria can too, so that they can affect your brain health. I think we've learned so much over the last even 10, 15 years about chronic inflammation and the things that drive that, things like prediabetes, insulin resistance, the stages way before diabetes that then make you more prone for a vascular dementia or other, you know, points of cognitive decline. And it's really a kind of easy thing to say, go to the dentist, get cleanings, and if they think that you have periodontal disease, you know, they wash out your mouth with some antibiotic and they tell you to floss a little better, and they do that scaling and planing thing. But you just go into the office and then you follow up with the dentist. And it's amazing. I mean, I have physicians who have diagnosed people after a heart attack because they had this systemic inflammation, had their mouth tested, found out what bacteria were in there, treated them, and those markers of inflammation that showed they were very much at risk for a heart attack come way, way, way down, because you're treating that root of inflammation in the body. And so just like, you know, the heart and brain react very similarly to a lot of these different diseases. And so those are all things that you can do something very easily about gum disease. Go to the dentist and brush and floss and everything your mother said, right?
Yep. And again, simple things to do, not costly. It's just about changing your routine if you've gotten out of the habit, or maybe you never had the habit. Very important. You know, one thing I'd like to have you do, because we're always getting new listeners, if you wouldn't mind, how do you explain to families the difference between Alzheimer's and dementia? Because so many people just think they're one and the same.
Right. Well, and all of dementia is not Alzheimer's, as you know, right? So Alzheimer's is a specific type of cognitive decline or dementia, but there are other things. I mean, Parkinson's has a dementia associated with it, which is not Alzheimer's. But again, it still does give you that cognitive decline. And then there are the diseases that can be masked as Alzheimer's or misdiagnosed, like we talked about before, depression, thyroid, all those things. So you need to have somebody who's going to do the right cognitive testing. I mean, the only way to truly diagnose Alzheimer's, as you know, is by autopsy, right? Is to look at the brain and say, yes, you have all those changes from Alzheimer's. We use it more as a diagnosis of exclusion once we've ruled out the other things and you have those symptoms. So you need to understand what you need to look for so that you can determine, is it truly Alzheimer's? I mean, I know there are some new tests out there. I spoke to one company, they can do a skin biopsy and they can diagnose Alzheimer's very precisely, except that skin biopsy costs a lot of money. And would you do that to just make sure that's what your diagnosis is, or if you've ruled out everything else, you feel comfortable that yes, that's where I am. And then since there is really no cure at this point, it's kind of, it's important to have the right diagnosis if there's something you can treat.
Yeah.
But if you're at the Alzheimer's, point, then we just have to do the best that we can.
Yeah. And, it's interesting because so many times people will go, well, my mom's got dementia. We don't really care what kind it is, but it is important to know. I sometimes agree that as it progresses, you don't have to continue to take tests because there isn't anything that can change. And if a family is aware, but again, I think that's an individual family choice in terms of what's going on there. But thinking of the disease category, because dementia is really a category, like the flu is a category, like the common cold, like cancer, and then there's all these subcategories that fall into that family base of whatever the category is. And what I have seen and heard from many people, because of course, who wants to say, yeah, kill me, take the autopsy, let my family know? That's not the route we're going to go.
Not where we go.
No, like with my mom, we thought she had Alzheimer's. That's what she was diagnosed with, but she did have an autopsy. And the autopsy showed some Parkinson's, and it also showed some Lewy body. And so I sat down with the doctor afterwards and I said, explain the medical gobbledygook to me, because I don't know all this language and stuff. And he was wonderful. And I don't know if you're familiar with Dr. Fry here, who started the whole nasal insulin thing and had a dream back in '77 to kick that all off. But, he sat down and kind of said, well, I'm going to ask you, what did you see as far as Parkinson's? And I said, well, she became less mobile, but we didn't really necessarily know that it was Parkinson's because she was so far along in the disease process. As far as Lewy body, a lot of Lewy body people will have hallucinations and delusions and things, and we didn't really see that. We'd see her talking sometimes with people who had passed. I said, but as a family member, I'd gotten to the point of, she's comfortable, it's okay. What do I know? And she's not hurting anybody, she's not hurting herself, and she's not upset. So we didn't dig deeper in that, but the majority of it, was Alzheimer's. And they looked, he literally said, Lori, I've never seen a brain that has shrunk this much. And he said, but after 30 years, this is exactly what we should expect, to be able to see. And then, others sometimes will be told, well, you were diagnosed with Alzheimer's, but now it's Lewy bodies, or now it's this and this, and lucky you have 2 or 3 types of forms of dementia. What are your thoughts in terms of trying to explain to a family how things can maybe change along the line?
I'm usually a pretty pragmatic type of person to say, if it's going to make a difference, I feel like it's very important. If there is a different type of treatment for it, or if there, for example, Parkinson's, if there were Parkinson's drugs that maybe could have helped the Parkinson's part and made her a little more comfortable, it may have been worth that. But once you've gotten rid of the diseases that you can treat, right? Once we've made sure this isn't thyroid or blood in the brain or whatever else it is, I think you have to really sit with the family and say, okay, how important is this to you to know exactly? Because whether it's Parkinson's, dementia, or Lewy bodies, or Alzheimer's, is there some different treatment we're going to do? And if there is, then I think it's important to know. But if there's not, and we're doing supportive care, then, you can go down, a whole rabbit hole of testing, to your point, and other things. And where is it really going to get you anywhere else in the end? Maybe the family just needs some more support to understand, how to help this person. When you talk about your mom talking to people who have passed, as long as she was happy, it's not hurting her, it's not hurting you. So to the point, sounds like you did a great job at the time of coming to grips with it and not getting mad at her and not yelling, what are you doing, what are you talking about? I think, there's probably more treatment that needs to go to the family. The only other piece I would say in there is if there is something that could be hereditary, then you really would probably want to know, like some of that, which is way off topic, but that very early onset dementia that, you know, happens in people's 40s and 50s. There's some families I've seen, you know, read about. That's a little bit different, because then you're wanting to find out, is it truly going to affect you at that moment? But otherwise, if it's Alzheimer's, Lewy body dementia, you know, are you going to do anything, Parkinson's dementia, are you going to do anything to prevent any of those? Well, hopefully you're doing, eating a good diet, exercising like you can, getting your hearing tested and all those other things, and would mitigate any of the risk factors, you know, trying to keep your brain as healthy as you can, busy and as active as you can for as long as you can, you know, and social connections too. I know that this has been a very tough time for a lot of people. Actually, in our survey, over 60% of those who already had cognitive decline during this COVID period had a worsening of the cognitive decline and had increased feelings of depression or anxiety. So it's really taken a toll even on those who maybe some think, you know, it wouldn't affect them much.
Well, it's huge. And that brings me to another question, because with COVID-19, you know, a lot of people are being impacted not only by the health piece, but that social and emotional piece. And, you know, I have always said, people go, oh, your mom can't have the disease. I mean, way back when, no one lives that long. And I'm like, well, leave it to my mom to break that rule, you know, but I believe she lived that long because she was engaged, because she felt part of her community. She felt loved and still felt that she could give it. And I also think that she stuck around because she had a lot of lessons to teach in this process itself. How are people coping with COVID-19? You know, have you heard from families? Because this affects everybody. I mean, a lot of them can't go to adult day, or they can't get their respite, or they're scared to have home health care come in. They were going to move, but now they're not going to. I mean, these are huge, massive decisions. And so, you know, what I've been seeing on my side and hearing from people living with it, and then the professionals out there, is, you know, families are scared to death. Some of them hadn't seen their loved ones for 4 to 6 months, and they didn't know if they were going to die, or their loved one was going to die, or would they no longer remember them by the time they got in. I mean, they worried heavily on these things. And yet a lot of people, you know, friends and family kind of poo-pooed it. You know, this isn't that big of a deal. It's not going to have that big of impact. From professionals, where people were like living in a community, I was hearing everyone did really good until that kind of 2 to 3 month marker. And then that's when they started really, and it was amazing because everybody kind of at that, between that 2 and 3 month marker, everything was changing. And did it really change? We'll never know. Or could staff finally breathe, trying to figure out what's the new process that they were noticing? But a lot of issues going on out there.
Totally. And in our survey, we actually surveyed wide range of ages. So 2 out of 3 felt increased feelings of depression or anxiety. And it was interesting because when you look at different age groups, I know we're talking more cognitive decline and older, I actually would have thought that the older, 65 and older, would have done the worst in our survey, but they didn't. It was that sandwich generation. It was us. Now, it was, you know, those taking care of their kids and their parents. Actually, sandwich generation is younger than I am, more that 35 to 49. But when they're worrying about their parents, they're worrying about their kids. 1 in 2 of those people said they felt like they were losing their mind at some point during this time. And over 60% said it affected their relationships. So if they are taking care of an older family member and they're falling apart, and depressed or anxious or really affecting the relationships, it's only going to make the relationship with the parent even worse. You know, as I said before, the survey showed that those with cognitive decline did worse. I thought I just read yesterday also in the news that death rates were increasing with those with cognitive decline and all, due to even just the lack of socialization. I mean, I've seen it with my 13-year-old and my mom, who's 86 years old today, And just seeing those two, my mom doesn't live with me, but seeing the way those two were locked in the house for months, and not having their usual, social engagements. I mean, when my mother lives in New York, and when she told me she was starting to play bridge with 3 friends, I sort of had a little bit of a heart attack. Like, no, Mom, you're 86 and she doesn't have any risk factors. You can't go out there. And she's like, well, we're all only seeing each other. We're wearing masks. We're playing bridge outside. We're not having food. And we're washing when we get in the house, and we're hand sanitizing between hands. I'm like, well, I think it's more important for you to be with your friends right now rather than in your house by yourself all this time, than worrying as much about, as long as you're being safe, and we know how this can be transmitted, so as long as you're wearing your mask and washing your hands, we feel better. But I think nobody really realized what that social isolation is going to do to any age group, but especially those, and especially if you're in an assisted living or something, and have to watch out the window to look at your family. I just can't imagine what people have gone through during all of this.
Yeah, it's been hard. Families have said it just breaks their heart because the person inside is going, come on in, get in here, come on, because they're not understanding.
We're not allowed.
The whole process, and get that thing off your face, and all of those types of things. It's just it's very interesting. And now that people are allowed back in, they're all garbed up, with the PPE, and so that's changed. And some families have in some communities are doing like Zoom meetings and FaceTime and things like that. But I have one gentleman in my memory cafe, and they actually set up an iPad in his wife's room, and no one needs to touch it after it's initially plugged in, and he can pop in and just check on her anytime. And he says, she can't always see me or figure out where the voice is coming from, but it calms him down. Yes. And so now in his community, there are quite a few people that have said, hey, help us do that, because like you said, the care partners, it's tough. It's tough on everybody. And I'm glad that the whole social isolation is coming to a head, and the importance of feeling included and purposeful and connected in community. I'm hoping that's going to help us bridge the gap just in the world at large, the importance of inclusivity. Now, I also wanted to just ask, in terms of the survey itself, is that something that people can still take, and is it still available, or is it closed?
No, it is available. You can take the survey. You can learn a little bit more about brain health. We have some great information up there for you. And then you can learn a little bit more about MDVIP also. And if there's doctors near you that, would have the time to partner with you and help you if you are concerned about your brain health or your heart health or whatever it is.
Oh, that's wonderful. I know people like taking surveys. Do you know how long it takes to complete?
It's not long, about 10 minutes maybe. I mean, not even that. It's a short survey. Just there's some true false questions, and things like, and it's interesting, things like, is Alzheimer's fatal, true or false? Questions about the other diseases, and we have all the answers, so you can learn about what you got wrong or what you got right. So you'll find out if you passed or failed.
I'm excited to personally go take the survey myself and get out there. I think this is a really important piece, and I'm sure, and people look at me as an expert, but I'm sure there's things that I might not get right either. Plus, I don't like taking tests, so I'll use that as an excuse as well.
Well, nobody will know what you get, so don't worry.
No one but me. But that's okay. It's I think it's good to be informed. I think it's good to encourage people to take these things. It's just another way to connect, and then help us with research in terms of where are the needs. That is critically important for people to know, so that we can design programs that'll really help and support one another.
Right. I mean, all of this, but I think that, knowing what drugs can work on it. So then you need to work backwards and say, well, what's the root cause? I mean, most of my educational career, we were looking at amyloid for everything for Alzheimer's, and then things move on. Is it tangles and what's there? So, there needs to be better diagnostic tests. My doctors all the time ask me, we have a lot of screening tests for cardiovascular, they do cognitive testing, but they said, we don't have heart attacks or strokes in our practices anymore because at MDVIP, we do the right screenings and we can treat the patients and help mitigate their risks. I need help with cancer and Alzheimer's. Those are the two things that my physicians want to be able to diagnose earlier and being able to help them. So we've done research. I've had even some of my doctors have talked to the world's experts and all. And, there's nothing that's just at prime time yet that you can, go to your doctor and say, order me this myeloperoxidase, which is a great cardiac inflammatory marker for heart disease. There's nothing like that right now for Alzheimer's. I have some hope for the liquid biopsy blood tests for cancer coming down the pike, but I think Alzheimer's, we're still a little bit behind that. And so until we have an easy, I don't want to say cheap, but an easy, reasonably priced test so that everybody can get it and get it as early, and maybe even something that can follow you. I mean, that is one thing about cognitive testing. And when you do things like in the doctor's office, they ask you to remember things or, what day is it, all that kind of stuff. If you actually follow people on some of those screeners, you can start to detect small changes in cognitive decline so that you can get somebody very early on. So maybe you can understand their risk factors, make their blood sugars better, get their gums cleaned out, maybe they have depression that's adding to it or a thyroid issue that's adding to it. Treat everything so you can hopefully keep their brains as healthy as long as you can.
I do want to get into a little bit more of what differentiates MDVIP from others, but is there anything else along the dementia line that you wanted to mention specifically?
No, I think we got through everything there. I mean, I can tell you more about MDVIP. We are a national network of primary care physicians everywhere from Florida to Maine to Alaska to Hawaii. These physicians have the time to sit with you, talk to you. The cornerstone of this model is a yearly annual wellness program where you get about 2 hours between some of the tests and spending time with the physician. So time to sit and talk through all your tests, identify things, and then make a plan for the year, an annual wellness plan. It's sort of like getting that executive style physical that you would go somewhere for, but then when you come back with the binder from the executive physical, nobody's helping you implement it. Our doctors not only do the executive physical, but then they help you all year round to implement it. Our doctors do things like, pre-COVID, walk with the doc. So they'll take their patients and help them walk, take them to a grocery store and teach them, shop with the doc, teach them, go to the produce aisle, don't do those end caps where they put all that sugary pre-processed stuff, walk by those. But so trying to build that sense of community that, you were talking about before. I've published articles supporting the network, showing that not only do we identify more people at risk for heart disease, not only do we take better care of chronic conditions, but we save the healthcare system money. Last year alone, we probably saved Medicare about $600 million just in the decrease in hospitalizations, the screening, and the taking better care of people.
Wow, that's huge. And Lord knows in the economy that we're living in right now, we need to watch the dollars and cents, and we need to keep people healthy. I think so many times people talk about our healthcare system not as preventative, but it's always like 10 steps behind, so you're ill, and so there's something to fix instead of trying to head it off ahead of time. And I love the personalized service. I mean, who would ever think that a doctor might go to the grocery store with you or whatever it might be, or I don't know, maybe when they're visiting, just going for a walk instead of sitting in, so they're actively doing, walking the talk together. Through the process and stuff. That is really unbelievable. Anyone interested in that, I am imagining, can just go to mdvip.com for more information. and see who's in their area.
Mhm.
And then do they contact one another throughout the year at all? I'm sure that's another thing people will be.
So then it is your primary care physician.
Mhm.
So that they will, if you have a cold, you'll go see them, or if you have diabetes, you'll follow up with that. But they do multiple checkpoints anyway to make sure that you are following the wellness plan that they set out. If you're trying to lose weight, you may come in more often for coaching versus, if you're 35 and pretty healthy and go through the whole yearly visit and we don't find much, maybe you'll come in, in 6 months just for a check-in. But they'll, follow up. There's a lot of personal touch there because there's the time. They limit their practices to about 600 patients, and so that they really have that time. Most office visits are half an hour, and then those yearly visits are anywhere between an hour and 2 hours, so that you get a lot of time. There are no more doorknob questions because you get everything answered in the office. And then if you call during the day, the doctor will usually call you right back or talk to you right then. It's not like I always laugh with the doctors when they come into the network to say, it's a paradigm shift for your office staff. They have spent years keeping patients away from you, and now they have to let them in. They have to be able to say, hey, so-and-so's in the waiting room. They need 5 minutes. I got this room ready for you. Go take care of them. Same day appointments, then you get their cell phone number. It's really that time with the physician and that yearly wellness program, like the executive physical, that can really help identify disease.
Wow, that's fantastic. Is there a cost to this, and how does it work?
So to join an MDVIP practice, there is a membership fee. Average across the country is $1,800 for the year. And so for that, you get, the time with the physician, the yearly executive physical. And then, whenever you do go see the physician, it is also supplemental to insurance. So our doctors all take Medicare and the commercial insurance. And so if you go in for a sinus infection, they'll bill your insurance. But if you go in for your yearly wellness program, that's all of what's included in that yearly membership fee.
Gotcha. And it must be nice for the doctors too, I mean, people always say in healthcare, people get into it to, have this personal relationship. And so they actually get to really know their peeps now, instead of just this in and out and feeling this pressure. I mean, that I would think as a physician, that just has to feel really good.
You kind of hit the nail on the head there. I mean, for them, many of them are burnt out now. I mean, you see this all over the news, and in traditional practice, they're just churning through 20, 30, even more patients a day. And there is no time to really prevent disease. I mean, they're literally doing reactive medicine, putting Band-Aids on things. And so when you get a very good physician who has the time to step back and really look at somebody who comes in and want to prevent disease, no matter what age. I mean, my mom, as I said, is 86. I still want somebody to think preventatively for her, right? I don't want her to have a stroke, because then what if she ends up, in a nursing home and not having a good quality of life? That's not what I would want for her. So you need somebody who can do that. And for physicians, this is why we went to medical school, right? It was sort of our calling to make people feel better and to keep them healthy. And that's what at the root of this personalized preventive care model is, keeping people healthy so they can live healthier, more vibrant lives.
Well, thank you, Dr. Klemes, for joining us today. This has just been so interesting and fascinating, and I really encourage our audience to go and take that survey. You got nothing to lose, everything to gain, and not only for yourself, but from a research standpoint to help doctors really figure out what are the needs, where's the education lacking, where do you need support. And again, you can go to mdvip.com/brain health. Wonderful, wonderful information. So again, thank you so much. In wrapping up, I'd like to again thank Dr. Andrea Klemes with MDVIP. She did an excellent job with us today. I learned so much, and it was just a really comfortable conversation. So thank you. And for our listeners, please like, click, and share. Don't forget to pass this episode on. It's important for people to take that survey to get the information they need, and it's only going to take about 10 minutes of your time. Till next time, We will catch you later. Bye now.